in October. We are pleased to be able to talk about health issues today, and health issues that are important to registered nurses in Canada, but also are important to Canadians. The last segment, which will start shortly before 11 a.m. Eastern Standard Time, is called Questions from the Audience. And I encourage you to send your questions by posting them on CNA's Facebook page. We will select 7 questions from the audience, and for the questions that are not able to be talked about with the candidates, we will share those questions with the candidates so that they will have a feel for what is on the minds of people related to health issues. With less than 2 weeks to go until the voting commences for the first ballot, which begins on September 18th and closes on October 1st, the NDP leadership candidates agreed to join us this morning to share their views on important health care issues. Today's Facebook Live virtual town hall is our way of bringing the conversation to you, and I'm pleased to introduce the 4 candidates who have joined us this morning. 2 of the candidates are with us at CNA House in Ottawa, and 2 of the candidates are joining us by a virtual connection. So we are crossing our fingers that technology is with us today, and everything will go according as planned. In alphabetical order, the candidates are as follows. Joining us virtually is Charlie Angus. Charlie Angus is a Member of Parliament for the Ontario riding of Timmins-James Bay. He was first elected to the House of Commons in 2004. After the 2015 federal election, he served as the NDP critic for Indigenous and Northern Affairs. He most recently held the position of Vice Chair of the Standing Committee on Indigenous and Northern Affairs. Nikki Ashton is joining us today at CNA House. Nikki is the current Member of Parliament for Churchill-Kiwatanuk-Aski, a riding in Manitoba. She was first elected in 2008. Following the 2015 federal election, she served as NDP critic for Jobs, Employment and Workforce Development. She also recently served as Vice Chair of the Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disability. Guy Caron is also with us at CNA House this morning. He is the current Member of Parliament for the Quebec riding of Rimouski, Naget, Témiscouata, Lebasque. He was first elected to Parliament in 2011. After the last election, he served as both the NDP Finance Critic and Vice Chair of the Standing Committee on Finance. And finally, Jagmeet Singh is joining us virtually. He is the current Member of the Provincial Parliament in the Legislative Assembly of Ontario. He was first elected in 2011 to represent the GTA riding of Bramley-Gore-Malton. He also served as the Deputy Leader for the Ontario NDP. We are very pleased and honoured to have the 4 candidates with us today. I've just been passed a note, and please, the technology gods have left us behind a little bit this morning, and just please be patient with us as we sort out a technical glitch with Facebook. We have a few ground rules of which the candidates have been previously apprised, and David Gronowski, Manager of Government Relations, will serve as our timekeeper today, and he'll monitor and flag the candidates when they're approaching the end of their speaking time, and will sound a bell when the allotted time is up. And there you hear the bell. We'll begin with 5-minute opening statements from each candidate, and following that, we'll have a lively segment called Questions and Conversations with the President, and it will feature 6 questions for which each candidate will have 1 minute to answer. Following this, all those joining us today via Facebook Live will have the opportunity to ask questions during the Questions from the Audience segment. So start typing, get your questions in, and you'll be able to virtually interact with the candidates. Each candidate will have 1 minute again to answer your question, and David will also give them a 10-second warning before their minute is up. We may not have time to address all the questions, but as I mentioned before, we'll make sure that the candidates have all of the questions that have been submitted during this event. I also wanted to stress that the tone of this event is more of a conversation. I didn't wear my referee shirt today, so it's not a debate. We are giving the candidates the opportunity to have a conversation, put their points of view forward related to health issues. So we'll start. We have a lot to cover, so let's jump right in. And we will start with the opening statements from each candidate. And Charlie Angus will be first. So Charlie, we'd like to hear from you and your opening statement.
Well, I really thank you for putting this event on, because I have such enormous respect for the work that nurses do. My grandmother was a nurse at Timmins Hospital. All my aunts were involved in nursing. And your organization really is the front line of medical services in this country. Personally, I'd like to thank the nurses at Sunnybrook who did such incredible work with my sister, who just passed 2 weeks ago in the palliative unit at Sunnybrook. And I spent a lot of time over this last winter at Sunnybrook seeing the work that is being done by nurses. So this is an important conversation. I'd like this morning to talk about a couple of key areas, because as we know, the delivery of health services is under the jurisdiction of provinces. The federal government has walked away from so much of its traditional role that it used to play, and it's creating holes in the system. So what role is the federal government in terms of the working with the provinces and territories on healthcare? That's a fundamental question to the NDP, because it's our proudest achievement was the fight with Tommy Douglas for universal healthcare. So I'd like to talk this morning about a couple of key issues. One is the status of these side deals that the Prime Minister signed following Stephen Harper's walkaway on the Health Accord. I'd like to talk a bit about palliative care and the work that I've done on it, because I think the federal government has a key role to play in issues of palliative care. Under areas of federal jurisdiction in terms of health, which are prisons, federal prisons, soldiers, veterans, and Indigenous communities, the failure of the government and the deliberate malpractice and negligence by the federal government and denial of medical services to Indigenous people has to be called out, and I'll speak a bit about that this morning. In terms of the Health Accord, what was really disturbing about Stephen Harper's plan that Justin Trudeau's followed up on is that it picks winners and losers, and the losers are rural regions, regions with aging populations. I represent some of those regions, and we can see the effects of not having the investments in regional and local hospitals, the people relying on locums, people falling through the cracks. It has a huge impact on delivery of health services and the quality of life for people. As a federal NDP candidate and future leader, I will be pushing very hard to set a better framework agreement for the federal government to make sure that we are putting in place health transfer payments that will respect and work with all the regions of our country, and not the system that we have now. I spent, on the issue of palliative care, I spent a fair bit of my time in the last Parliament pushing Motion 456, which received unanimous support. But the problem with receiving unanimous support in the House of Commons is everyone agrees to the principle of the federal government playing a role in palliative care, but where is the action? We saw no action from the previous government and little action from this government. The importance of palliative care, of course, is that the vast majority of dollars being spent by the medical system happens in the final year of someone's life and in the palliative period. There's a lot of work the federal government can do. One of the issues I had pushed for is the reestablishment of the National Secretariat on Palliative Issues. That would have been a fairly straightforward plan. The federal government could work on best practices with the provinces and territories, because we see some areas where we have amazing coherent delivery of services for pain management, home care, palliative services, the integral tying in of all these pieces together creates quality health care. And in other areas we see patchworks, and that happens within, even in certain areas, certain regions and provinces. The federal government could help coordinate a much better response on issues of palliative care. The issue, of course, that's very close to my heart is the deliberate failures by the federal government in the delivery of health services. And I don't want to be cynical about the fact that we now have 2 ministers in the Department of Indigenous Affairs, but how many ministers does it take to end a federal court action against the Human Rights Tribunal over the federal government's refusal to provide quality health services to Indigenous children under Jordan's principle? We have dealt with, in my region, doctors and nurses being overridden by bureaucrats, young people being denied audiology tests from Ottawa, women being denied mammograms if they're on reserve because the government doesn't want to pay for their flights out for tests. That's not acceptable.
Thank you, Mr. Angus. Thank you, Mr. Angus. Your time is up.
Oh, I was just getting started.
Well, we'll give you some time to get revved up again when the questions start. Nikki,
Thank you.
Your turn. Please go ahead.
Thank you so much to the Canadian Nurses Association for hosting us today. It's, I think, a testament to your support for advocacy that you are hosting us today as leaders and potential leader of the New Democratic Party. And of course, it's no secret that we in the NDP have a strong connection to those that work in the healthcare profession and a very strong care for healthcare, given that it is our party and pioneers like Tommy Douglas and many others that fought for universal healthcare. And I want to certainly acknowledge your work in representing 139,000 registered nurses across the country. You represent many that are on the front lines of taking care of all of us. And I would also acknowledge as someone who for years worked as the status of women critic in the NDP, the particular advocacy you give towards working for working women, recognizing that much of the work done by nurses, yes, there are many men, but obviously a significant majority is women, and you and many members that are part of your organization have been on the forefront of fighting for women's equality, and for that I and many are very thankful. I want to begin by explaining that that the reason why I'm running in this leadership is because I believe that our country is at a crossroads, and that the two biggest challenges of our time are growing inequality and the threat of climate change. Earlier this year, a report came out that indicated that 2 Canadian billionaires own the same amount of wealth as the 11 million worse off Canadians. And while we often talk about how as Canadians, we're different than the United States, we're better than the United States, the reality is that we are becoming more and more unequal, in some cases more than in the United States. And now, in looking at what that inequality looks like, inequality in our country has different faces: Indigenous, racialized, immigrant, disabled, queer, trans, women, seniors, and for the first time, I would say in our history, an intergenerational face, the face of inequality faced by the millennial generation in our country. This has been an area that I've had the opportunity to do a fair bit of work as I launched a national tour on the rise of precarious work in the millennial generation. And what I heard in that journey, but also throughout this leadership race, is a clear understanding that we didn't just end up here, that this kind of inequality didn't just happen. It is a result of political and economic decisions that have brought us to this place. Decisions like privatization, deregulation, outsourcing, austerity, bad trade deals, increased foreign ownership, and increased corporate concentration. And so what we have been saying is the need to recognize that this status quo that has brought us to this point can no longer work for us. And instead, we need to come up with a bold, progressive vision. A bold, progressive vision that makes it clear that what we need is greater equality, fairness, and ultimately justice for Canadians of all generations and of all walks of life. And that's why I'm proud that our campaign has put forward a bold vision when it comes to health, when it comes to broader issues of justice, economic justice, environmental justice, and social justice. And our healthcare vision, which I hope to elaborate on as part of the questions as well, is very much focused on the understanding that we need to build on Tommy Douglas's vision, who said Medicare was the only the first step, and we needed to go further. So what we've said is that going further means committing to a national universal pharmacare program. It also means committing to universal dental care. And it also means committing to a mental health strategy directed by the federal government and obviously working with other jurisdictions, including the provinces. This bold vision is rooted in the understanding that we must be looking at the social determinants of health, and that ultimately, if we are going to tackle inequality, we must be looking at the health and wellness of Canadians across this country. And I will say that we've heard incredible support for the kind of vision that we've put forward on pharmacare, on dental care, on mental health, and the recognition that as Canadians face greater inequality, they are looking for a bold vision that puts their health, their wellness, and ultimately our dignity first. Thank you.
Thank you, Nikki. Guy, you are next. Please go ahead with your opening statement.
Thank you very much. Thank you. Thank you very much, and thanks for the Canadian Nurses Association to organize this town hall. One thing I was remarking is the fact that through the 7 debates we had so far, and we have our 8th and last debate this Sunday, we didn't have a theme team debate, basically a thematic debate, and this is the first one, and it's really welcome that we do it on healthcare. I do have some links with healthcare, of course, especially through my in-laws. My mother-in-law was a nurse. My sister-in-law is a nurse. My wife, at the time I was elected, was actually working in the pensions department of Victorian Order of Nurses, VON, here on Argyle Street. And in my past, I had a chance to work at the Council of Canadians against privatization of healthcare, which was in the mid-2000s. It was a real challenge because at the time, or around the time I was working on those issues, Brian Day was the president of the Canadian Medical Association. So I was working against privatization, and I met wonderful people at the time, obviously the representatives of the CNA, but also the Canadian Federation of Nurses Unions, Michael McBain at the Canadian Health Coalition, and I worked with Canadian Doctors for Medicare. At the time, Dr. Daniel Martin was actually president. So I came to have a broader understanding of healthcare and the issues that we are facing. I could say that the person that marked me the most, or that had the most impact on me on healthcare, was Michael Rackless. I would consider myself a disciple of his view on health policy. And we have to come to the realization, of course, that we don't have one healthcare system. And that's where Canadians are misled the most. We have 13 healthcare systems. We have one for each province. We have one for the territories. We have one for Indigenous people. We have one for veterans. And the fact is, the federal government has lost its moral authority or moral caution to bring forth the changes that we need to ensure that we have a healthcare system, or many healthcare systems, that works. Why? Because initially, if we have healthcare in this country, if we have public healthcare in this country, it's because the federal government committed to pay for 50% of the bill. And obviously, provinces joined. Quebec was the last province to join. And after joining and after having Canada Health Act, then the share of the federal government started to decrease. And right now, depending or not if you're counting tax points, the federal government is contributing to between 17 and 23% of healthcare costs. We are facing a situation where the demographics will increase pressure on our healthcare systems, and Liberals haven't really helped by trying to trick provinces basically to accept the Liberal priorities, which are important. I mean, we're talking about healthcare and home care, but to the detriment of the funding that is required right now to face those demographic pressures, to face the issue of population aging. I could come here and promise you the moon in terms of healthcare, which I will not do because we have systemic problems with our systems. The problem is that we're looking at the healthcare system in bits and pieces. Obviously, we have the core system that we have right now, but we're talking about the need, and Nikki mentioned it, of mental health, home care, palliative care, of long-term care, of prevention, of mental health, of dental care. All of that are bits and pieces that should be added, but we should have a comprehensive view of what healthcare needs for the future. And if the federal government has lost its authority because of the lack of funding, and provinces are really worried about federal disengagement of the healthcare priorities, it can play a role of leader. It can play a role of leader to ensure that provinces can sit together and share their best practices. There are wonderful things being done in Quebec right now in terms of primary care, frontline care. That's not shared across the country. Something in Alberta for hip and knee replacement in the public system. It's not shared. So provinces are not talking to each other. So the first thing that the federal government has to do is to ensure that it plays its role. And then we have to look at giving a better funding to the provinces with having this integrated healthcare system in our mind. And the federal government is best placed to do that because no province will take the leadership. So this is what I want to bring as the leader of the NDP. This is what I want to bring as the next prime minister of the country.
10 seconds.
And this is why I'm in this race, to really provide a better future for healthcare. Thank you.
Thank you, Guy. Jagmeet, you're next, and we're welcome to hear your opening statements.
Well, thank you so much. Like my colleagues have said, we're all incredibly honored by all the work that nurses do across the country, and CNA is a powerful organization for advocacy, for representing not only the concerns of nurses, but also really broadly speaking about or advocating for the concerns of health across the country. So thank you for all your great, great work. I want to start off by making it absolutely clear that as New Democrats and as leader, I am absolutely committed to not only protecting our existing universal, publicly delivered one-tier healthcare system, but we need to expand it. It's not enough to just defend it. We need to expand that healthcare system to ensure that it's universal, that it's publicly delivered, that it's truly broad speaking, and that we have to make sure that it is expanded. And we know that the areas of expansion are pharmacare. We know the other areas of expansion are universal dental care. These are the missing links in our medical care system. I think it's really important to highlight that we are the only country amongst countries where there is universal health care that we don't have universal pharmacare. And we know that there is a significant argument to be made, a significant healthcare argument in terms of costs, that people are right now in a situation where they can't afford to pay for their medication. We know that seniors are often reducing and rationing their medications. They're cutting their pills in half so they can stretch out their prescriptions. They're skipping days and sometimes not even filling prescriptions at all. 25% of Canadians don't have access to prescription insurance. 10% don't fill them at all because it's too expensive. CLC recently launched a campaign around ensuring that we move towards universal pharmacare. It's absolutely important. We know that people should not be in a position where they're so ill that they have to go to an emergency room before they receive medical care. We need to ensure that they receive medication so they don't get that ill in the first place. Universal dental care is another step. Dental health, dental hygiene are so inextricably connected to one's overall health and well-being. And while we talk about these specific social programs, much like many of my colleagues alluded to, and much like the incredible work of the CNA alludes to, we know that there are significant social determinants of health. And in fact, that these are some of the major factors in determining one's health. And as Prime Minister, as leader, I want to ensure that we eliminate the differences in quality of life and health based on income, gender, race, and geographic location. We need to ensure, much like Charlie was talking about, that there is no inequality, and particularly the inequality that impacts Indigenous communities. So I want to ensure fair and equal access to healthcare services with Indigenous communities by addressing these completely appalling conditions when it comes to housing, clean water, overcrowding, and other issues that directly impact health. We also need to ensure that we connect with the reality of an aging population. So we need to ensure that our seniors have access to quality home care. People want to be able to live in dignity in their homes, and we need to make sure that they can stay in their homes as long as possible. And that means that people need to have quality care at home. And finally, health promotion is something that I really believe in. It's something that we have the power to do at the federal level. And we need to ensure that there's that there is healthcare, and we need to make sure that this healthcare, this health promotion, is something that we look at with respect to nutrition guidelines, access and information around how important it is to have healthy nutrition, healthy access to food. We need to not only promote the awareness and education around healthy food, but making it more accessible, making sure that people can actually get access to healthy food. On top of that, we know that we can prevent much illness with physical activity, but right now we don't have healthy communities that we need to promote, ensuring that there's a principle or a policy around ensuring there's healthy neighborhoods to ensure that health and social communities are embedded right where people live. We need to work towards making it easier to be active, making it easier to access programs that encourage activity, not just for young people, but for seniors as well. We can build a healthier society. This will require a lot of great work on all of our parts and a lot of collaboration. Much of this work is going to require collaboration with municipal and provincial partners, but this is something extremely important, and so I'm looking forward to the challenge. I think it's extremely important that we all work together to do this. Health is one of the fundamental pillars of our social democratic values, and it's something that I'm absolutely committed to. Thank you so much.
Thank you very much to all the candidates for your opening statements. And now we'll move into the second segment of our conversations called Questions and Conversation with the President. And as a reminder for this segment, each candidate will have 1 minute to answer each question, and David will give a 10-second warning before the time is up. Our first question is related to home care. In October 2016, CNA, the Canadian Home Care Association, and the College of Family Physicians launched a very important intercollaborative initiative called Better Home Care, a National Action Plan, and it outlined the federal government's role in home care. The plan reflects the needs of patients and reinforces that home, not hospital or long-term care facility, is the best place to recover from an illness or injury. It's the best place to manage long-term conditions, and it's the best place to live out one's final days. One of the key recommendations in the joint report calls for the federal government to support large-scale spread of best practices across the country by leveraging and enhancing current pan-Canadian resources that are building capacity and improving performance in the home care sector. This is my question to the candidates this morning. Would your government work with stakeholder groups such as CNA to scale up best practices to ensure that home care is improved and access is standardized, regardless of your postal code? If so, what would your government do to make this happen? Jagmeet, you'll be the first one to answer this question.
Well, thank you very much. Home care, as you said, is absolutely a growing concern, something that's incredibly important given our aging population. And as you stated, it's absolutely the preferred way that people want to live out when they're ill, when they're recovering. People want to be able to live at home, and particularly, as you stated, in the final days. As much as possible, people want to live in their home. So it's unacceptable that 1 out of every 5 Canadians is just not receiving the care they need. So we need to support PSWs, RNs, nurses in general. We need to ensure that we develop training hubs in rural and remote and Indigenous communities. These are centers that can ensure that we have care that's delivered at home. We also need to have policies that support the informal caregivers, the people that friends and families that are caring for their loved ones. So we need to ensure that caregivers are protected when they need time off, to ensure that there's adaptations to make sure that caregivers' homes are accessible and that these financial investments are supported at the federal level. We need to make sure we invest in human resources, again, particularly in support workers and nurses, to make sure that all communities have access to quality home care, and in particular, Indigenous communities. And finally, we need to really work on investing in critical... That's good.
Time is up. But thank you for that response. And Guy, your turn. 1 minute.
Thank you. Actually, I mentioned in my introduction that the first thing that the federal government has to do is to bring our provincial partners to the table and ensure that they can exchange best practices. No province is taking the leadership on this. It belongs to the federal government to do it, and home care is a prime example of how we have to look at the healthcare system as an integrated system. Home care is not an extra expenditure for the healthcare system. By integrating healthcare and by going forward with a strategy, which I actually heard the CNA present in the Finance Committee, we can ensure that a good integration will not only help people to be healed at home or to be treated at home in friendly confines, but it will also eventually bring about savings in the system. The fact is, when we are looking at home care, we have to look at the future of healthcare, and the federal government has to invest and has to work with provinces to invest more.
Thank you very much. Nikki, your turn.
Well, first I'll say I'm proud to come from a province, Manitoba, where you see very clearly what NDP leadership looks like in the creation of public home care. And in fact, my grandmother, who just a couple of months ago was left the hospital, was able to be at home because of the public home care system that she's able to access. That to me shows what NDP leadership looks like. But currently, if you see what's happening in Manitoba as well, it speaks to how we have to be vigilant in every case in terms of the gains that we've made. In fact, there have been some first steps towards privatizing home care that pertain especially to outsourcing some of the jobs. And that's something that I believe, well, no question has to be stopped, but it really points to the need for federal leadership on home care, and recognizing that, yes, we need to work with provinces to ensure that home care is accessible to all and funded federally.
Thank you, Nikki. Charlie, please provide your response.
Well, I was certainly honored to work with Libby Davies, our former health critic, on a dual strategy on home care and palliative care. Of course, they're so interrelated. To that, the federal government can play a role in starting to work with the provinces on best practices, starting to put some funding into home care, because this is the future where much health care will be delivered. For that, in terms of palliative care as well, we need to look at EI changes to make it easier for people who have to take time off work. I know certainly with my recent sister's passing, a number of family members had to take time and leave to look after her. The question also I think we need to raise is the issue of precarious work, because it may sound great to move nurses and PSWs out into the field, but we have to make sure that they're not just on these perpetual contracts, or they're only being paid when they actually are dealing with patients and not for travel and for other services. So these issues of the fairness of work has to be something that we put on the table as well.
Thank you very much. That was great, our first question. And now I just want to remind people who have joined us on Facebook Live that we will be taking questions from the audience. So post your questions on our Facebook page, and we'll try to ask them in the next segment. Question number 2, we eased into things with home care, but now we're getting down to the nitty-gritty with legalization and regulation of cannabis and a harm reduction approach. On April 13th, Bill C-45 was tabled to provide legal access to cannabis and to control and regulate its production, distribution, and sale. CNA's submission to the Standing Committee on Finance pre-budget consultation calls for funding for a public education campaign, and this campaign would commence prior to July 1st, 2018, the date that the legislation is expected to take effect. Public education campaigns will need to provide Canadians with ways of reducing the risks associated with non-medical use of cannabis. For example, delaying use until early adulthood, avoiding driving after at least 6 hours after inhalation, which vulnerable groups such as youth and pregnant women should abstain from using the drug, and so on. As NDP leader, would you support such a campaign? And if you do, why is it necessary to have one? And Guy, you're the first one to provide your response.
Thank you. Obviously, in terms of Bill C-45, in terms of the eventual legalization of cannabis, I do believe it's a positive step forward. I was always in favor of the criminalization for public policy reasons, but also for economic reasons, because repression has failed. So we need to look at what can be working, and this will be working if we do it well. But you're right that we'll need to actually have funding for raising awareness on the issues, the same way we do it for other harmful substances, such as tobacco and alcohol. I mean, it's obvious that the strategy, if we are legalizing, has to be accompanied by the way to demonstrate the risks of using those substances. This is part of a harm reduction strategy. We are facing a problem, though, right now with legalization that's coming, but with the provinces not really aware of their powers and not really well funded to actually provide and be a full partner in this. And this is where the Liberals are failing right now.
Thank you very much. Nikki, your turn to provide your response.
Well, first of all, to your question, I mean, we would certainly, if elected leader, we would certainly be keen to work with you in supporting your call for a public awareness campaign. Obviously, the NDP has been in support of legalizing marijuana, and we've also made it very clear that that there are holes in the government's rhetoric on this matter, particularly the failure to decriminalize marijuana and the continued targeting of many, particularly young people and particularly racialized and Indigenous young people when it comes to a marijuana possession. And so we've called clearly for that decriminalization. I mean, what's evident to me is that nurses have a responsibility and engage in that responsibility on a daily basis on the front lines of harm reduction. And so we should be giving you the tools, including the support of a public awareness campaign, and ensuring that that legislation is implemented in such a way that ensures people's safety and well-being.
Thank you very much. Charlie, your turn to provide your response to the question.
Well, when we make marijuana legal, we certainly need a public awareness campaign. There's going to be a lot of issues that have to be addressed that are not being addressed right now. There's certainly health determinant issues that we have to start putting out there, and so there has to be that public leadership and conversation. But I feel this needs to be done in a whole manner of areas. I know that in my region, the overprescription of OxyContin in the early days that led to the oxy abuse crisis right across Canada. I was working out of my office trying to raise awareness about it because of the huge impacts that the overprescription had, and that has resulted in now in the fentanyl crisis. We need, when drugs are being brought in and we start to see issues, we need public awareness to make sure that people are safe, and certainly with the legalization of marijuana, good public awareness and a clear vision from this government, but where they're going, they need to be more upfront because there's a lot of unanswered questions right now with where this government is going to take this file.
Thank you very much. Jagmeet, your turn to provide your response and perspective on the question.
Well, thank you very much. So right off the bat, first and foremost, yes, I would absolutely support CNA's campaign to build public education on the safe use of marijuana. I deeply believe in the government's responsibility to get out into the communities and do meaningful, effective education around new policies in general. But specifically, I really believe that the CNA is in an excellent position to provide public health awareness and health education around the impacts and harmful side effects of recreational marijuana use. I think it's absolutely important. While it's a completely separate issue, but it's very important at the same time to ensure that we immediately decriminalize absolutely any form of possession of marijuana. We immediately work towards destigmatizing people who have records based on this. In terms of the health awareness, this is absolutely important. I think the same way we spend millions of dollars in tobacco education and safe use of alcohol education, we need to spend that type of resources towards providing information in this area.
Great, thank you again to the candidates, and you lived through question 2. So on to question number 3, which has been called by many people the heartbreak of Canada: mental health and Indigenous communities. The 2017 federal budget provided $5 million over 10 years for mental health initiatives. CNA issued a position statement in 2012 on mental health services, and it states that we recognize that access to mental health services in primary and community care-based settings must be improved, and CNA is committed to supporting the development of policies, legislation, and funding mechanisms that facilitate timely and equitable access to mental health services across an integrated continuum of care. Many Indigenous organizations have identified significant funding needs to help stabilize and expand access to mental health programs. As Prime Minister, what types of policies would your government introduce to support Indigenous communities that have been experiencing ongoing states of emergency related to mental health? Nikki, you'll be the first to provide your response on this question.
Well, this question hits close to home. Coming from northern Manitoba, I have the honor of representing and working with 41 First Nations. And in the last few years, we've struggled, and I've worked with folks that have been on the front lines of suicide crises, where young Indigenous people have lived, have reached a point of such hopelessness that they've taken their own lives. It's clear to me and many that we are talking about the impacts of colonization and an ongoing colonial approach to First Nations. This idea that Ottawa knows best is simply not true. We need to be listening to Indigenous people at the community level, many who are Indigenous nurses, Indigenous healthcare providers, and Indigenous youth when it comes to solving the challenges that people face. We need to address the underfunding in housing, healthcare, and education. We need to make sure there are recreation services, and yes, we need to fund primary health care, including in mental health.
Thank you, Nikki. Charlie, your turn to provide your response.
The federal government was found culpable in the deaths of Chantel Fox and Jolyn Winter of Wapakeka because they knew that the community, there was a suicide cluster in Wapakeka. They refused to spend the money and those children died. And now this government is at the federal court trying to overturn the Human Rights Tribunal ruling against them. Following their refusal to put that money in, we lost Jarena Roundsky in that community, and we just lost this morning another 12-year-old girl. This is the effect of systemic negligence, where Health Canada doesn't even track the children that are denied services. Just because you don't track them doesn't mean you're not responsible. We have crisis after crisis after crisis, and if enough children die and the international media pay attention, then the federal government will say they will put together some task force, and it goes back to the same routine, which is they refuse to put the proactive money in place to protect children from these suicide clusters.
Thank you very much. Jagmeet, please provide your response to the question.
Thank you very much. Just putting my timer on here so I can keep on time. First and foremost, this is an incredibly important issue. This is something that is devastating communities, and I thank all the candidates for their responses. We need to confront the fact that this is a continuation of the legacy of genocide committed against Indigenous people. And as a part of our colonial legacy, the mental health crisis is also inextricably linked to housing and poverty we see in these communities. So we need to look at the social determinants of health when it comes to mental health as well. We need to immediately work on some approaches to solve this problem. A team-based approach to counseling services, which includes social workers, counselors, community healers, and support staff available in communities, schools, community centers, home visits. We need to move towards a 24-hour health hub, something that is led by nurse practitioners, something that can provide the health care and the mental health care. We need to immediately repair nursing stations on reserves that have fallen to disrepair so they can be used as centers for this implementation of healthcare. There's so much work that we need to do. It's just it's crushing.
Thank you very much, Guy. Your response.
Being for it, I'll try not to repeat everything that's been said because I think we're basically in agreement. I'll talk about the breach of trust that we are witnessing right now because the federal government, the Liberals, have increased expectations. They put the bar so up, so high, and they are not meeting those expectations right now. They promised to eliminate the ceiling, the 2% ceiling on the investments in health and education and social services. They are not. As Charlie mentioned, they are still going and challenging the court's decision regarding child support services. As long as we are in this government, I don't think we can hope to reestablish that trust that will be needed to address the issues such as mental health and the suicide clusters at front. What we'll need to do is to truly invest, to do exactly what the Liberals should have done,
10 seconds.
But truly invest. But the way to reestablish that trust will be to provide basically measurable outcomes and say, here's what we will do in the first year, in the second, third, and fourth year, and we'll be held accountable.
Thank you very much. I just want to interject now with a little commercial for our Facebook Live folks. We have 3 questions left: social determinants of health, antimicrobial resistance, and palliative care. And then we'll turn it over to the audience. So I want to encourage people, if you have a question, post it on our Facebook page, and we will pepper the candidates with your questions in the 3rd segment of our conversation today. Question 4 relates to the social determinants of health. And this is a foundational concept for the practice of nursing. The social determinants of health are the conditions under which people are born, grow, live, work, and age. CNA has a position statement on the social determinants of health, and we call for a health in all policies approach to promote health equity for Canadians. We continue to encourage federal parties and parliamentarians to take action on health through such an approach that reflects the principles of primary health care as described in Alma Ata 1970. The specific type of care that nurses provide enables them to understand the various factors that can affect a person's health, including employment, income, education, housing, literacy, the physical environment, and more. With the goal of promoting economic growth, productivity, and prosperity, how would your government, under your leadership, consider the consequence of all federal public policies, laws, and programs to improve the health and well-being of Canadians? Charlie, you'll be first to provide a response to this question.
Well, when I worked with the homeless in downtown Toronto, the issue of getting proper housing to get people off the streets is a fundamental in terms of mental health, getting people out of the emergency wards. I remember meeting with palliative doctors out of St. Mike's just 2 years ago, and they said that if you're homeless, you're palliative because you're already dying. So a national housing strategy is necessary. The fact that we don't have support programs in place for addiction services, mental health. People are falling through the cracks all the time. We need to address this because the effects on the overall system are enormous. And then going back to Indigenous communities, the cycle of poverty, the fact that in many of our northern reserves they're called Tylenol clinics because Health Canada won't provide proper medicine and drugs. We have young people getting sick and dying, elders dying, people having to be medevaced out for things that should have been handled at the front line by the nurses if they'd had the support and they had the medical system in place. We cannot have a third world medical system for people just because they're living on reserve. We have to address that. That's a fundamental issue of justice for our time.
Thank you very much for your response. Nikki, your turn.
Well, I'd start off by saying that I appreciate the work of the CNA and many others in prioritizing a social determinants of health frame. It's absolutely critical in understanding that as inequality increases, our health decreases, our well-being decreases, and that's something that our campaign has and our vision has really considered foundational. If we're going to tackle inequality, we're going to have to tackle it in every single way and recognize that it requires comprehensive approaches to policy. That's why our economic justice platform calls for tax reform, making sure that the rich and corporations pay their fair share so that in turn we can pay for pharmacare, dental care, mental health services, and free tuition. We've also talked about the need to tackle climate change and have very strong, stand up to those that seek greater profits at the expense of people's well-being and the well-being of our planet. And I would say that also in terms of social justice, sorry, I didn't catch the 10-second.
Sorry.
and all to say that it has to be comprehensive.
Great, thank you. Guy, your response.
Well, when we're talking about social determinants of health, this is obviously a very important part of preventive care. I mean, if we can prevent through other means than simply looking at the medical way of doing it, then we can actually save a lot. We're talking about the nonce of prevention, prevents, and it's also, and I fully agree that it has to be part of each decision that the federal government takes in every aspect of its its work. I'll give you one example of it, which is a proposal I put forth of a basic income. This is promoted also by Dr. Daniel Martin as something that is really crucial in terms of determinative health, because the stress that you need to get through just to survive on minimum wage or under minimum wage makes it really difficult on the person. And it's been demonstrated that basic income, for example, will decrease the rate of hospitalization and has other benefits that will save society a lot of money.
Thank you very much. Jagmeet, your turn to respond to the question.
Thank you very much. I think one of the key areas when we're tackling the social determinants of health is fighting poverty and inequality, something that my colleagues have all talked about. We know that Canadians who are struggling to get by are also the same folks that have the worst health outcomes, whether it's diabetes or mental health challenges or repeat hospitalization. So this is why I've launched my campaign with a bold anti-poverty agenda. The first piece of my campaign in terms of policy was My Better Work agenda, which talks about how we can fight to end precarity in the workplace, how we can improve labor standards and secure a $15 minimum wage. But it doesn't end there. We need to make sure that there are folks that are struggling right now, and that's why I've included income guarantees and basic income guarantees and supplements for those who are struggling right now.
10 seconds.
Canadians living with disabilities and Canadians living, or in Canadians and seniors. And finally, national housing strategy and a green climate and climate change agenda. It's something we need to do.
Great. Thank you very much. On to question number 5, antimicrobial resistance, AMR. And you may wonder, why in heaven's name would we be asking leadership candidates a question about antimicrobial resistance? Why wouldn't we just keep the clinical questions to ourselves and solve that problem? But CNA recognizes that antimicrobial resistance is a substantial threat to health both nationally and internationally. And the International Council of Nurses, which is 113 nursing organizations across the world, has identified antimicrobial resistance as one of the top 3 concerns in the world. Nurses across Canada are well positioned to take action on antimicrobial resistance, and we minimize the need for antimicrobials, of course, by preventing infections in our day-to-day practice through a variety of mechanisms, including immunizations, infection prevention and control, and preventing AMR through low-cost, high-impact stewardship activities. CNA has made representation to various committees regarding antimicrobial resistance, and we've participated with other groups to develop a Canadian multidisciplinary, multi-sectoral action plan on antimicrobial stewardship. So I guess what I'm saying is antimicrobial stewardship, the use of the appropriate use of antibiotics, infection prevention control, is a concern of all Canadians and the health of Canadians. We've also engaged with Choosing Wisely Canada to develop a broad nursing recommendations to reduce the use of tests, treatments, and interventions that lack benefit or could actually cause harm. Our pre-budget submission to the Common Standing Committee on Finance had recommendations related to antimicrobial resistance and antimicrobial stewardship, to increase knowledge and awareness, to establish a national network, to support and scale up practices that already exist. My question to you as Prime Minister, how would you work with the Minister of Health to prepare health practitioners such as nurses to combat the developing global AMR crisis? Nikki, you're first to provide your response to this question.
I want to thank the CNA for your leadership on this front, recognizing that this is a very serious issue that will only become more serious unless we have a plan in place to take it forward. It's clear to me that, if elected leader and then Prime Minister, it would be important to ensure that that we do our work very much based on evidence, recognizing the threat that AMR poses to, patients, healthcare professionals, and frankly, our society. So investments must be made to ensure that we have a handle on the situation as it is, but also that we are working on preventative measures, and I particularly think of many populations that suffer chronic illnesses, recognizing that we must ensure that in those cases, and frankly in all cases, that we are acting responsibly.
Thank you very much, Nikki. Guy, your response.
Well, it's obviously work is needed at the global level, as you mentioned, and if we're talking about the global level, all global politics starts locally as well. And we need to ensure that provinces who have the responsibility start doing the job as well, of at least raising awareness and having family working in the healthcare system. I can tell you that the level of awareness in our healthcare institutions is far from perfect. So we'll need to do it locally. We need to ensure that once again the federal government can play a leadership role in bringing provinces and all healthcare elements together to ensure that this is made a priority. And we should not also forget, even though we're talking about obviously human AMR, the veterinary aspect of it as well, because antibiotics are still being administered to cattle and to basically the animals that are going to be used as meat as well. And that compounds the problem, and a full comprehensive strategy will not be comprehensive until we address this situation as well.
Thank you very much. Jagmeet, your turn to answer the question.
Sure, thank you very much. You know, in university I studied biology, so I studied actually pathology, epidemiology, and we actually learned a lot about the increased resistance to antibiotics. Just to highlight how important this issue is, we might return to a period where we can't treat common infections anymore with antibiotics, given the direction we're headed with some serious superbugs that are resistant to pretty much all forms of antibiotics. So I think that we absolutely need to do some work around launching education campaigns around the proper use of antibiotics. I'm also concerned with the overuse of things like antibacterial soaps. I think that we know that this is also adding to the problem. We need to improve data available to nurses and other practitioners to develop a national surveillance program. There should be national standards that align with the World Health Organization's plan for antimicrobial resistance. And we also need to look at some of the government use of, in the Ministry of Agriculture, with respect to antibiotics in the animal husbandry field to ensure that we protect our population there as well.
Thank you, Jagmeet. Charlie, your turn to answer the question.
Thank you. Well, government has known this has been coming for a long time, and now we need to take this very seriously. I think part of it is certainly in terms of individual patients is the importance of access to pharmacare so that people who are prescribed meds can fully take them, and there's huge gaps in that. Certainly people being able to be treated at home as opposed to hospital would certainly make a difference. But the big issue before us is the fact that 80% of antibiotics that are being produced are going into industrial agriculture, and 70% of those have crossover implications for human antibiotics. So we need to start taking this issue seriously, start working with the agricultural sector in terms of trying to find ways of having more sustainable farming so that we're reducing that abuse of the antibiotic system, because the effects now are being seen in our hospitals.
Thank you very much, Charlie, and thank you all for your responses to that question. We're now going to move to the last question in this segment, and I want to give another little mini advertisement for people who would like to submit questions on Facebook Live. I can tell you the questions are coming in fast and furious, so I think it will be a very entertaining fasten your seatbelt section that will be coming up next. So if you want to submit a question, this is going to be your last chance to be able to do so. And just to remind you that any question that we don't get to in this particular event will be shared with the candidates, so they will have the knowledge of the questions that people are asking. Now on to the last question, another area where nurses have a significant influence on the health of the population, palliative care. In March 2017, CNA appeared before the Common Standing Committee on Health for its study on the Act providing for a development of a framework on palliative care in Canada. In our submission, one of CNA's recommendations called for the reinstatement of Health Canada's Secretariat on Palliative and End-of-Life Care And our submission stated that the National Secretariat would oversee the development, implementation, and maintenance of a national palliative care framework, and it would set strategic directions and establish a coordinated, comprehensive, pan-Canadian approach to palliative care. We're pleased that that recommendation made it to the version of the bill that was passed by the committee and finally at third reading in the House of Commons, and we will continue to monitor the bill as it goes through the Senate. Our submission also called for a different way of approaching the issue via a palliative approach to care that is person-centered. This approach is guided by the core tenets of palliative care, which are dignity, hope, comfort, quality of life, and the relief of suffering, and should be applied early in the course of the illness and through to the process of advanced care planning. My question to you this morning is, what are your views on this approach? And if you are in agreement, how would your government help provincial and territorial governments and palliative care nurses implement a person-centered approach to palliative care? Guy, your response to the question.
Well, obviously it makes lots of sense, but once again, we have to look at it in an integrated way, a comprehensive way of looking at healthcare. I do remember I've been part at one committee meeting of the medical assistance in dying bill, and one of the big problems with that bill was the fact that palliative care was just outside of it. If we're discussing such a bill, we need to discuss at the same time palliative care and to some extent also home care and long-term care. They're all linked to each other. So yes, I'm in favor of this approach. I'm also in favor of ensuring that the federal government can convince the provinces, bring them together and ensure that this integrated view is the one that dominates, because as long as we're talking about individual components of healthcare this way, we are missing a big chunk of the large picture that will help us to improve healthcare the way it is. And any funding that will lack this comprehensive view will unfortunately lead to some missed opportunities.
Thank you. Jagmeet, your turn to provide your response.
Thank you very much. First of all, I also want to just acknowledge the incredible work done by CNA on improving end-of-life care for all Canadians. We know that, as you stated, palliative care, it's clear that Canadians receiving this care would like to be able to spend their last days in the comfort of their home, yet we know studies show between 60 and 70% end up staying in hospital. So the patient-centered approach is the most humanitarian. Therefore, what I propose doing is using targeted investment and legislation to ensure that all Canadians that want to choose their end-of-life location can choose to live at home and have access to this care. We need to establish a national framework of best practices for palliative care to ensure that the same quality of care at the end of life exists across the country for people regardless of what region they live in. And we need to ensure that there's culturally specific emotional, spiritual bereavement supports in remote and rural communities to ensure that Indigenous communities receive the appropriate care as well.
Thank you very much. Charlie, your turn.
Well, I spent much of the last Parliament bringing motion 456 through Parliament, and part of that was getting all parliamentary support for reestablishing the Palliative Care Secretariat, and this is a very important piece of getting a national framework on palliative services. The reality is the money is being spent. It's just being spent in a whole area of fragmented services under provincial and territorial governments. There's better ways of coordinating and working together to bring that patient-centered, family-centered approach. In one region I represented, a rural region, their palliative care budget was $72,000 for 2 hospitals. How do you establish a coherent framework with that? The other area is public awareness, starting to have an open conversation about end of life. Most people, when they hear the word palliative, think it means death, as opposed to a form of care that will bring holistic support for family and the person who's suffering.
Thank you very much. Nikki, your turn.
Well, without question, the NDP supports your work in terms of seeking national leadership and the creation of a national secretariat. And I want to acknowledge the work of Charlie and many New Democrat MPs that have gone before us that have fought for palliative care leadership at the national level. It's clear to me that while we need leadership, we also need resources, and that I believe means reversing the cuts that Stephen Harper made to the healthcare formula, putting revising these one-off deals that this new government has agreed to with provinces, and truly taking seriously the need to invest adequately in our healthcare system. Given the demographic changes we are facing in our country, we have no choice but to invest in palliative care. And I also want to acknowledge the importance of recognizing the particular underfunding in rural and First Nations area in this specific area of health.
Thank you very much, and thank you to all the candidates. We've touched on some really important healthcare issues in the prepared questions, and now for the fun. And I guess my commercial was working better than what I thought, because we have a wonderful group of questions. I don't know what the questions are. You don't know what the questions are. So we will ask the questions in a rotating manner, ask for responses in a rotating manner. We will work until 30 minutes past the hour. And again, I will make sure that the candidates get copies of the questions that we aren't able to get to. And Carolyn Pullen, Director of Policy Advocacy and Strategy for CNA, has been collecting the questions and doing a really good job of theming and putting things together. So we'll ask as many questions as we can fit in until 30 minutes past the hour. And the first question, and we'll start with Jagmeet on this one. As Prime Minister, what would you do to ensure Canadians have better access to affordable pharmaceuticals? How would you pay for this? And how would you engage with Canadians to develop a plan?
Thank you very much for the question. I think the first step is acknowledging that at the federal level, we're in the best position to provide a national plan with respect to pharmacare. We can use the buying power of Canada to buy medication in a bulk and then provide it and have people have access to it. I prefer the model, which is a completely universal, one-tier, publicly delivered pharmacare program that involves absolutely free medication for all. Working towards that system, there's a number of models to move ahead in that direction. Provincially, in Ontario, we've launched a program that our leader, Andrew Horvath, proposed, which is to ensure that commonly used drugs are covered first, and then the program is expanded. We know that in terms of how to pay for this program, it's a program that's an investment that will pay for itself. There's significant reductions in costs associated with healthcare when you have a pharmacare program in place. So other jurisdictions have done this, and I see this as an investment that will actually pay for itself.
Thank you very much. Guy, your turn.
Well, obviously pharmacare should and has to be a priority, and there's plenty of, we're talking about how to pay for it. I do believe, and I've been a follower of the work of Marc-André Gagnon at Carleton University. Actually, I had the chance to work a bit with him at the end of my tenure with the Council of Canadians. Taking into account all the savings that we will get through such a decentralized system that we have, it's such an efficient system that we have across the provinces, it wouldn't take more than 5 to 10 billion to actually ensure that we have a full pharmacare system across the country with national formulary, and also ensuring that we do bulk purchases through the federal government. But it won't necessarily be easy. Let's remember that healthcare and education as well are provincial responsibilities. It will require for the federal government to sit down and ensure that we get the provinces on board. And this will be the tricky part. But I do believe it's essential if we want to ensure greater affordability of prescription drugs, which is the fastest rising cost component of healthcare. We need to move in that direction.
Thank you. Nikki.
Well, thank you for that question, and I acknowledge that a growing number of Canadians are raising the importance of this issue, including many young Canadians, and that's a reflection of the growing precarity that many young Canadians face with a job market that includes many jobs that don't have the kind of benefits that, say, for example, their parents have had, and they're looking to the federal government for a universal pharmacare, and I'm proud that our campaign has put that forward. We've called for the creation of a Canada Pharmacare Act consistent with the principles of the Canada Health Act. We've called for establishing an essential drug fund as part of the Canada Pharmacare Act. We've called for creating a Canadian drug agency to get a better deal on life-saving medication from big pharma companies. And we've called for the need to set reasonable price limits on patented brand name drugs. And I'm proud that our campaign has put forward a detailed plan when it comes to universal dental care, and I thank you and many who are calling for it immediately.
Thank you. Charlie, your response to the question.
Well, the issue of establishing a national pharmacare plan will be one of the fundamental principles for my government. This is the unfinished business of Canada's public health care system, and it needs to be addressed. I'm fully in agreement with the recommendations from the Canada Health 2020 report. What we need to do is put this investment in working with the provinces and the territories. We work with them as our partners. But we also need to be very much aware of the effects of the trade deals that we saw with CETA, the pressure from the pharmaceutical industry, certainly with the NAFTA negotiations. We need a leader in the House this fall who's going to be standing up and making sure that our ability to establish a national pharmacare system is not going to be undermined by regulatory changes through NAFTA negotiations, because there will be a lot of pressure from international corporations to stop our move to bring this into reality.
Thank you very much. And here's a second question from our friends on Facebook Live. What should the federal government do to stop the creeping privatization of healthcare in Canada? Guy, you're first up to bat on this question.
Thank you. Well, if the federal government has so many difficulties, there are two problems. The first is the lack of willpower from the federal government through Liberal and conservative governments. But the other part, which is even more important, is because of the decrease in federal funding and the federal share of funding of healthcare. We have lost basically our ability to impose on provinces what should be done. And provinces have used this freedom, in quotation marks, to actually delist more services and to actually let privatization creep in the system. Now it's difficult for the federal government, which pays less than 25% of healthcare costs, to tell provinces, well, you have to respect the Canada Health Act. And provinces are paying over 75%, and they feel entitled to actually go in that direction, which in the end will cost their citizens, and citizens have to know it.
10 seconds.
So what we have to do first and foremost is to ensure that we are bringing back the escalator, bringing back the federal funding of current services to a decent level so that we can have a voice in the matter.
Thank you very much. Nikki.
Well, thank you for that question. And as I stated in my opening remarks, privatization isn't only an attack on a value that we hold dear, the access to universal public health care, but it is also a force in rendering our country more unequal. This idea that if you can pay, you can be better off is something that ultimately brings all of us down. What is needed is national leadership and the clear application and implementation of the Canada Health Act. This would also involve working with jurisdictions that are beating back privatization, and I want to acknowledge the work of the Alberta NDP government on this front, and many advocates across the country, whether it's with respect to the provision of private MRI clinics or private surgeries. There are many on the front lines that we need to be working with at the national level and acting on in an immediate sense to stop the creeping of privatization.
Thank you, Nikki. Charlie, your turn. Oh, I think we've lost your audio, Charlie.
Hello?
Oh, there we go. Okay, carry on. We've got you back.
Okay. Thank you. I'm certainly concerned about the federal government's refusal to pay their share, which has put pressure on provinces and territories for delivery of services. But one area we have to pay really close attention to is, again, going back to the trade deals. We saw the Trudeau government support the sell-off of largest retirement home chain in BC to a Chinese company with pretty murky ownership structure. This allows a foreign government, foreign corporate interests to have a stake in our healthcare system. So when we're negotiating issues like TPP and we're saying that our public healthcare system is going to be exempt, there will be a claim that says that, well, wait a minute, we've got corporations who are investing in your healthcare system. So I'm very concerned about the government's open policy, particularly with TPP in China, to open health home care to this kind of foreign buyout. It could have long-term implications that will not be good for our system.
Thank you very much. Jagmeet, your turn to answer the question.
Thank you very much. I think, first of all, we need to really just highlight how troubling this trend is. The trend is real. Across Canada, we're seeing the encroachment of privatization in our healthcare system, which is unacceptable. We know that the implications of this will be devastating. It will result in a two-tier healthcare system. It will result in the eroding of this publicly delivered universal healthcare that we're so proud of. So what we need to do is, one, we need to ensure that we have adequate financing at the federal level in terms of healthcare transfers, but we also need to make sure that there is accountability with the Health Accord, with the Canada Health Act, to ensure that service is delivered in a public fashion. We need to be sure of that. In addition, the trade agreement issue. We know that when there's trade agreement, if there's certain services that have become privatized, it actually weakens our ability to maintain a public system. So even trade agreements are essential that we fight for public services being delivered publicly at all times, particularly in healthcare. So these are some of the areas we need to work on. We need better accountability, and we need to double down on a publicly delivered universal healthcare model.
Thank you very much. And the candidates are very impressive in terms of thinking on your feet to these questions that we're throwing at you. The next question we have, submitted by our listeners on Facebook Live, is the federal government is consulting on changes to the federal tax code for corporations to ensure all taxpayers pay their fair share. What are your views on the government's aim, and is this the right approach to tax reform? And Nikki, you're the first one up to bat on this question.
I would say, first of all, there's no question that if we're going to tackle inequality in our country, we have to tackle the issue of tax fairness. And I'm proud that our campaign has put forward a bold platform on tax reform. And as I noted earlier, it's founded on the notion of making the rich and powerful corporations pay their fair share. What's clear to me is that working Canadians, working class and middle class Canadians are paying their fair share of taxes. But the wealthiest are getting away from getting off of paying their taxes legally and even otherwise. And that's why I believe we need to increase the income tax on the wealthiest 5%, especially the 1%. We need to increase the corporate tax rate to pre-Stephen Harper era levels. We need to look at other tax measures that would ensure tax fairness. And while we welcome the federal government's current interest in tax reform, we certainly believe that we need to go much further in ensuring that Canada even sort of harks back to a more fair time when it comes to taxation for all.
Thank you. Charlie, your turn to answer the question.
Ordinary Canadians certainly pay their fair share of taxes. They don't get any breaks. I talk to young students who are audited year in, year out, because they're just going to university, and yet we see these corporate structures being set up to create, family corporations to not have to pay their fair share. It's not right. And so there's certainly a lot of whining right now in the media from certain interest groups who say it's not fair to them. Well, hey, everybody else is paying their fair share, but I would say the idea that Bill Morneau is suddenly Mr. Class Warrior is pretty ridiculous when they still are maintaining the $800 million corporate stock option loopholes, the deal they made with KPMG. We have corporate fraud artists corporations who are putting their monies overseas. There seems to be very little penalties for that. We have to get serious about everyone paying their fair share so the system works equitably for all.
Thank you. Jagmeet, you're next to give your response to the question.
Thank you very much. Is my audio working? Yes, it is. Yes, so absolutely, as my colleagues indicated, the fight against inequality, the fight to ensure that we have publicly delivered social programs, that we enhance those programs, requires ensuring that all people in our country pay their fair share, and that particularly means that those who are powerful, those who are wealthy, the high-income earners, the corporations, particularly the powerful corporations, the wealthy corporations, pay their fair share. And ensuring that we have tax fairness is something that's fundamental in this battle. We need to ensure that we increase revenue to be able to pay for social programs to tackle inequality. So looking at things like how I propose intergenerational wealth, high-income earners, increases on corporations, but also ensuring that we have a corporate structure that's actually truly encouraging small businesses as opposed to acting as a shelter for high-income earners. These are the steps we need to take. We need to ensure that we create an economy that develops small businesses but ensures that everyone pays their fair share, and particularly we ensure that there is no loopholes for high-income earners to not pay their fair share.
Thank you. Guy?
I'll take a wild guess, and I will guess that this question was related to the income splitting element of the tax reform that's proposed. I do believe that we need to address the issue of aggressive tax avoidance that's being done in that matter, but it's not in all cases. I mean, in many instances, doctors are actually acting like small businesses. They have staff, they have office expenditures. In some of the cases, they enjoy those benefits without really being a small business. The way that the federal government addresses it right now, I do believe, is trying to kill a fly with a hammer, in the sense that we are going to be broad-reaching many sectors of society and catching the good with the bad. And that's not the approach that we should be looking at. Fundamentally, I think this addresses the problem that we have with our tax system right now, because our tax system was mostly designed in the mid-20th century when we had, before computers, before globalization. We need to rethink our tax system to ensure that we truly close those loopholes and truly have a modern tax system.
Thank you very much. Moving right along, we have another interesting question from our Facebook Live. The federal government is leading the initiation of supervised consumption sites in Canada. What is your strategy to further improve access to these sites? And what is your view on the current trend of pop-up sites? And Charlie, you'll be the first to weigh in on this question. I think we're missing your audio, Mr. Angus.
I've got it now.
There we go.
Okay, so we certainly have to put the issue of public health at the forefront in dealing with the issues of addiction, particularly needle use and the brutal fentanyl crisis that's hitting across the country. So these pop-up sites, I think, will play an important role. But we also need to be looking long-term at the need to get better counseling and addiction services in many regions of the country. The ability of people who have become addicted to opioids is almost, the waiting lists are so long, it's having a devastating impact. So I think we have to look at the immediate issue of harm reduction, but we need a long-term strategy in order to help get people who become addicted get off this.
Thank you very much. Nikki, your turn.
Well, I certainly support the approach of supervised consumption sites, and I want to acknowledge that thankfully so many advocates and healthcare professionals have kept this issue at the forefront, despite a regressive federal government that we had under the Stephen Harper years. In fact, I acknowledge the work of Libby Davies and others in championing harm reduction approaches at a time when the government was maligning anyone anyone who did that, and certainly maligned the need for evidence-based approaches when it comes to helping those that are on the margins. We do need to make sure that there is federal leadership on this front, that we are listening to provinces and municipalities that want to move forward on this front. We need to support the interests in pop-up sites as well, and ensure that there is funding in place to support a true harm reduction approach.
Thank you. Guy, your response.
Thank you. I think the work that we have done in the last Parliament on this, fighting Conservatives on the supervised sites, and especially the work of Libby Davies, has to be recognized. It's been a hard fight. I mean, we were fighting a vision that was truly politics and not really in terms of public policy, and good public policy, because there's no denying, there's no way that we can deny the important role in terms of our harm reduction that supervised sites are playing. So we need to speed up the process, and that's the reason why those pop-up sites are coming up. It's because the federal government is acting too slowly to recognize the needs that we are witnessing in our communities. And in that sense, Liberals are different Conservatives in the way that they are open to them, and they are not going to fight them as aggressively as Conservatives.
10 seconds.
They are too cautious. They are too slow, and this is why we are seeing those pop-up sites coming up. And I think we'll see the trend going up or increasing as long as the federal government is not responsive.
Thank you very much. Jagmeet, you have the opportunity to close things off on this question.
Sure, thank you very much. So I think we need to understand that pop-up centers are a necessity to deal with a crisis. The opioid situation we have is a healthcare crisis across Canada, and what we need actually is a move away from the criminalization as a strategy to deal with people that are addicted, that have poverty issues, and instead of dealing with this as a criminal justice issue, deal with this as a healthcare issue, which means the decriminalization of all personal possession offenses and moving towards harm reduction. That means supporting supervised consumption sites, investing in permanent sites. The pop-up centers are a necessity, the mobile centers are a necessity, but we need full funding towards actually allowing consumption sites to be developed in a way that they're fully built, they have the right infrastructure to be able to deal with this crisis in a meaningful way.
Thank you very much, and I'm conscious of the time, so we've come to the end of our Facebook Live Town Hall with the NDP leadership candidates. Thank you to the candidates joining us, and I just want to say on behalf of CNA that we appreciate your willingness to put yourself forward for public service, because we realize that there's a personal cost, there's a professional cost, there's a commitment that's required by your families, and you're making a commitment to the citizens of Canada and to the principles that you hold dear. So we're very thankful that you've demonstrated your willingness to participate this way in our country. We hope that everyone has enjoyed our Facebook Live, and this has been recorded, so you can share this with your friends on Facebook, and don't forget to retweet a link to it if you are on Twitter. Stay tuned for upcoming events, and for any questions or comments about today's event, please contact David at dgornowski@cna-aiic.ca or call him toll-free at 1-800-361-8404, extension 525. And I want to recognize as well the work that the CNA staff have taken to put together this virtual town hall. I fly in, show up, do my thing, but it does take a village to put this on, and the CNA staff need to be commended for their efforts to make this thing work. And we will all say a little prayer of thanks to the technology gods who were all with us today. So once again, thank you very much for joining us. Thank you to the candidates, to our participants, and we wish you all the best. And goodbye for now. Merci beaucoup.